Barbara, every year with the Touchstone survey, usually the first thing we look at is what's going on with healthcare costs. What did this year's survey tell us?
Costs are still going up, and they're still going up in excess of 6%. What we saw is employers experienced a 6.8% increase in 2016, are expecting a 6.2% in 2017, but they're changing their plan design. They continue to use this cost-shifting approach to try and get the cost down. So they were able to drop it down to about 3.2%. The interesting thing, though, that we saw this year that was a little bit different, Greg, is we saw changes in contribution strategy to the point that employers are using surcharges more often than in the past. And that has resulted in a significant mix change. So we see a lot more people having single coverage than having family coverage. So the number of people for single only went from up to 47% from 41% in 1 year. So the idea of using surcharges for spouses and dependents that have coverage elsewhere went up 10 percentage points over last year. So it was really significant. But healthcare costs continue to rise at a rate significantly above CPI. So even though it's less than double digit, it's still not very sustainable.
So that challenge of multiples of CPI is still there. And because of that challenge, employers are going to continue to look for ways to share the cost burden of healthcare with their employees.
That's what we think.